Okay, we're going to talk a little bit about schizophrenia, which is a subject I love to talk about. So I'm bet you glad that we have very short video clips now. Schizophrenia, we've known for quite a while that schizophrenia is the result of a chemical imbalance in a person's brain. Remember that everything we do, say, remember, how we think, how we act, everything starts with an exchange of chemicals going on in our brain. Um, Now, there are a variety of ways that a chemical imbalance may occur that creates schizophrenic symptomology. There is a very strong genetic link, so we know that some people are literally born with the genetic predisposition to be schizophrenic. Schizophrenia can also result from substance use disorder, and there are, in some cases, an unknown component. Um, uh, we may not be able to identify specifically where that chemical imbalance, what's generated that chemical imbalance. Schizophrenia is treated primarily with psychopharmaceuticals, prescription medications, often known general class of antipsychotics. And these are chemicals that are, or these are medications that are used to try and correct that chemical imbalance, much like a person with diabetes might take insulin to try and correct that particular chemical imbalance. That's what psychopharmaceuticals are trying to do for the schizophrenic person, is to get that chemical balance righted so that the hallucinations, the paranoid thinking, all the various manifestations of psychosis. And psychosis is just a fancy word for people think things are there. They hear, see, smell, or touch things that aren't really there. And so the psychopharmaceuticals are trying to correct that chemical imbalance so that those hallucinatory experiences don't happen anymore. The challenge with prescribing any psychopharmaceutical for any condition, including uh, psychotropics for uh, schizophrenic conditions, is that we're all very individual as human beings, and our brain chemistry is very individual. And as I've said many times, we know about this much about the brain and how it works. And so finding the right chemical, the right prescription, in the right dosage for an individual person can be, um, it's a process of educated guesswork. Um, and of course, what you want to do is you want to find the medication and you want to find the dosage that treats the symptomology without creating other adverse effects for the person taking the medication. For instance, you don't want to turn them into a sedated zombie. Um, there are other side effects um, that can result from psychotropic medications. Um, and again, it's often hard, it's really impossible to determine uh, from the, from the get-go who might experience, who might be more susceptible to sedation. Tardive dyskinesia is another condition that may happen, and that has to do with sometimes you'll see people who have what we call finger flicking, or they'll have facial tics. Um, so again, it's all an educated guess. One of the challenges today in general with prescribing psychotropic medications is, first of all, these medications often take 6 weeks, 2 months, maybe even longer before taking them actually starts to make a difference for the person. And we're very much a hurry up society. And so people take these medications for a week or two and they go back to the doctor and they say, Doc, it isn't working. I still see that purple dragon in the corner shooting fire out of its mouth. Um, so that in and of itself is a challenge to have doctors and patients both who will give these medications a chance to see if they really work. Of course, you might spend 6 weeks, 2 months, whatever, and then figure out, nope, this isn't the right medication. So uh, we unfortunately can't operate in a pure clinical setting. Um, So just in general, keep in mind that any kind of an organic disorder, schizophrenia, any of the depressive disorders, depression, major depression, etc., bipolar disorder, these are three of the main examples of organic disorders that are probably going to be almost always are going to be treated with some kind of psychopharmaceutical. Now, after the person gets righted and the depression clears, the mood swings stabilize, the psychosis goes away, then you might have some kind of follow up therapy, skill building, behavior modification, resource management, etc., etc. The character disorders, um, again, these are the result of life experience, growing up, or even as an adult, major traumatic experiences. There's really no pill that you can give somebody with a significant character disorder to make that character disorder uh, fix itself. You certainly will find people with character disorders who are taking medications because they like the high and it's nice, good, clean dope that's readily accessible and cheap compared to going out on the street and scoring it. But that's not necessarily the best way to treat. Character disorders tend to, if they're going to respond, they respond to some kind of therapy, behavior modification training. In the worst, most severe cases, you're talking about simply containing the person so that their thought process slash behaviors don't pose a threat either to others or to themselves. Okay, running a little long here, going to go ahead and stop this video. Please submit any questions, observations, and we'll go from there.